next question is, this person seems to think that this your legislation is similar to Massachusetts, and says, why would it work in the United States case when they think it didn't work in Massachusetts?
We're unsustainable there.
I don't know whether it's working in Massachusetts or not. In Massachusetts, it has not yet fully gone into effect.
It has. It's 3 years. It's been there for 3 years.
Oh my God!
And I will tell you about Massachusetts. In Massachusetts, they've achieved about 94% of the coverage of their people.
Access to treatment.
The next question is, will this legislation or coverage pay for abortions?
No! I wrote the bill. It does not cover
The next question is, why does this legislation make insurance mandatory instead of voluntary?
because we are trying to cover 100% of the American people. And you don't know it, but each and every person in this room, is paying $1,060 for people who do not have health care, because it is tacked on your health insurance and it is tacked on your hospital bill.
I do know this, and I would rather pay $1,000 at the blood hospital than have to take
This person is asking what the provisions are going to be basically for small business owners, and particularly any pools that they could form.
The pools formed by small businessmen after the effective date of this act will have to conform with federal standards so that the people who are covered will receive adequate health care.
Who decides what's adequate? Who decides what's adequate?
No small business with a payroll of under $500,000 is going to have to do anything under this legislation. That will exempt approximately 96% of small business. Now, if you want to hear more, I'll be glad to tell you. Small businessmen will receive, who are covered, a tax break of 50% to enable them to do this up to a certain size, $750,000 pay raise. They will also find under this bill that small businessmen will also receive they will receive a break by being charged the same rate that big business is being charged. Big business gets their insurance for about 18% less than small business. We will see that that disparity is ended.
This person is asking, is there any provision in this coverage for health savings accounts, and if not, why not?
Hell no, because you don't want to give us the choice.
That's right. No choice.
Health savings accounts that meet the same standards that every other health insurance plan will have to meet will continue to be available to employers.
No choice equals dictatorship.
this insurance coverage be portable? In other words, go across state lines.
This is something I've been working on for 50 years. The answer is this health insurance program will be portable. But more importantly, you have to know a couple of things. Insurance companies will have to offer decent policies. Insurance companies will not be able to foreclose you from having insurance because you or members of your family have pre-existing conditions. Insurance companies will no longer be able to play games with you by fine print. They will have to, insurance companies will have insurance companies will have to tell you the truth in plain How many of you are against that?
Yes!
And insurance companies will have to have community ratings. And they will no longer be able to deny you insurance because of your age or your health.